Hello and welcome to yet another Human Synergistics webinar. Very excited about this one. I'm joined today by Michael Badu from the Dr. Becker Klinik in Wuppertal, Germany. So really looking forward to this. Healthcare is probably the area where our tools are used most widely, and I think this will be another really good and interesting example of how the tools are used and what kind of learning and benefit can be gained from using these kinds of approaches. So thank you so much, Michael, for joining us to share this story, and big thanks to Dr. Becker Klinik to allow us to talk about the case and everyone to learn something about how culture has changed in healthcare.
Yeah, thank you, John. I'm very excited to be here. Thank you for inviting me. I think I can just start.
Yeah, please.
Tell something about the clinic and the development. So I feel like it's kind of useful to start with the big picture. I started to work for Dr. Becker. We have 7 clinics in Germany, all of them are in different areas. And I started to work for the company 5 years ago. And I started in one clinic up north. Then I changed my position to another clinic, and this is like my 3rd station in the company. So I'm pretty familiar with the culture and the idea of the vision, the values, and everything Dr. Becker stands for. And I think this story of this clinic is pretty interesting so far, because we're still working on things. And when you reached out to me to tell you something about our story, I felt like this might be helpful for other people too. So I'm pretty excited to give some practical ideas of how to use your tool and how to start a cultural change. So at first,
Thank you.
Where do I start? It's like I'm trying to give you an idea of how I started to uh, provoke or to organize and to start the cultural change. I think it's very important to know that in the company we were pretty aware that we needed to change something in this clinic. So it was kind of a task for me to find out, okay, what's wrong in this company, because we had a lot of people leaving, we had a lot of troubles, we had sometimes people employees that were reporting things. So we were like, okay, this is not in line. Something has happened in this clinic that is not in line with our values, with our vision. And it was my task kind of to go into that clinic and start to look and to find for a way to improve the culture in there. And I was asking myself, okay, how do I start this? And I think this is a very important question. A lot of people who are doing leadership are asking themselves, okay, where do I start? There are so many things going on. And I can just give you an idea of how I do it. And I just decided to ask myself, who are the most influential characters in that organization? So to give you an idea, I started my first day there, and I started to walk around and talk to employees from all departments and all sections and everyone around. And I asked them, okay, who do you think are the most important people around here? Who are the people who run this clinic over here? And if you need an advice, who are you asking? Who do you talk to if you don't know something? And so I talked to all of them, and I started observing by my own. So I was trying to find, from my perspective, who are the most influential characters. And I also asked employees who are the most influential characters. And then I started comparing. It's like very practical. I made a list of 10 people who I consider to be the most influential people. And I also asked some employees to give me a list of the 10 most influential people over here. And then I started to talk to them, and I was like, hey, people are feeling like you are very important for this organization, and I have the same impression. So, what is important for you? So I started to talk to them and ask them what is important for them, and I also asked them if they were free to change anything that they want to. What would they? Where would they start? So this was like my start, and I used your tool because I was familiar with it from I think 2021. That's when we were using the tool the first time in the whole company, and yeah, and for that reason, I was familiar with the tool, and I started to use it for those people who are considered the most influential, just to have an idea of how they are um, influencing the culture in the clinic. And yeah, I learned something from that. You see on the bottom right on that little folder, like the first result of the first OCI I did back in 2021 with 11 people. Some of them were like first level management. Some of them were like employees. And I also made sure like I have at least one person out of every department. So there was one doctor, one nurse, one receptionist, one, I don't know, just like out of every section, even one from the kitchen and the cleaning stuff, like all of them. So I had all of them represented, and yeah, it was giving me an idea of where to start. And then there were also some things I was observing during the first weeks. Let me tell you about that. The first thing I observed was during meetings. You have to imagine in a clinic there are a lot of meetings all the time. Sometimes there are meetings where the medical team are discussing about patients. Sometimes there are meetings of, for example, the administrative section. Sometimes it's about, I don't know, just for example, someone complaining, and you learn something about that, and they have the meetings for change and stuff. So I was like attending all the meetings for 3 weeks without saying any single word, just observing everything and listening to them and have an idea of how the meetings are going. And what I found out, or what I was observing, was that in the meetings, there were always like the same 2 or 3 persons speaking. And a lot of people were sitting in those meetings, not participating at all. And I was asking myself, why is that? And for me, it was like pretty clear that those persons who were speaking were kind of very dominant and loud characters. So this was one of my first observation I made back in the days. The second one I made was like every time I talked to employees here and there, they came across with a lot of ideas, and they had kind of the impression that they every time they give an idea to the leadership team is listening and taking that idea and kind of promising, okay, we will work with that, and then nothing happens. It's like the employees, they don't get any response. What happened to their idea? And that was kind of frustrating them. And a lot of employees from different departments were like giving me that picture of how the organization is dealing with their ideas. And I was like, okay, that's another observation I made. Another one was like, I had the feeling that in the teams or in a department, for example, let's take, for example, the doctors as a team as such, they were kind of having they were having very good conversation, very good relations. They were working together. They were supporting each other. I had the opinion that in the team, everything was going pretty well. And even I had the impression that everyone was kind of loving the work, and everyone was enjoying coming to work. But also I found out that the doctors, for example, did not know a lot about the reality of the nursing team, and the nursing team did not know anything about the receptionist and the yeah. For example, like every department was kind of dealing with their own problems, so there was not so much interdisciplinary work during that time when I started. Um, the next thing I found out was like yeah, concerning like my work, when I tried to ask employees what the strategy is, or what are the goals for this year, what are important projects, I always felt like there were no project as such, and if there were some, no one could tell me. And also, like, sometimes they could tell me, okay, we're working on this, but they weren't able to tell me how the progress is going, who is involved with it, and how is it going, why is this so important. So I felt like transparency was another very important thing for this organization. And the last thing I found out when I was looking, just when I was checking just the numbers, I found out we have this is like for whole Dr. Becker. For us, it's very important to encourage our employees to um, attend training sessions, to educate themselves, to look for growth in any kind of possible way. And I found out that there's the budget for this clinic, like we have it in every clinic, and that this budget is meant to yeah, meant to be spent for our employees to attend trainings or other stuff that helps them. And yeah, I found out in the past 3 years, like almost nothing of those of that budget was used. So I was wondering, just from checking the numbers, okay, we don't use the budget for education. Why is that? So this was just a number based observation. Yeah. Um, and then I was like, okay, after I had all those informations, I was like, okay, this feels like this is not typical for our company. This is not typical for Dr. Becker, because even our vision is like we are looking for, or we are trying to invent a new way of doing medical rehabilitation in the 21st century. So we always try to ask ourselves, okay, this is the new century. We have different rules in this society. We have the new generation, and things that might have been important 20 years ago, maybe we don't need them anymore, and we need other solutions or other ways and paths to help our patients to yeah, to have a good time, and to yeah, cure and heal their traumas and everything, and that made them come to our clinic. So from then I was like, okay, I have all these kind of observations. And then there's the second very practical tip I can give you. The first one is try to find out who are the most influential people, because you will never be able to impact the culture without the most valuable persons in the organizations. So I knew who they were, and I knew what's important for them, and I had my observations. So then I needed to find a team that is kind of supporting me implementing a new culture and implementing another way of working together. And of course, it's obvious, you never can do that alone, not even as a clinical director. You don't want to come across top down and tell the people all the time what to do. So I was starting to looking for a team. And I think this is a very important aspect of our development too, um, because the idea of having a team that is sharing the same vision is like pretty obvious, but I think the hard question is how to choose the persons who fit into that team. So I used my observations, and I started to look for people who I consider to encourage us to develop into a better culture, no matter not considering any positions or anything that wasn't important for me. I was just looking for special characters with special ways of interacting with others that might fit into my idea. And I started talking to them. And what I found out is was like it was pretty easy to find them, because it's like the same way I did in the beginning. You can just walk around and ask people like who you consider to be. If it was up to you, who would you promote to a higher position, and for what reason? And if you go to a team, it's like in most of the cases you get the same answer. Sometimes people are not answering because there's already another person in the first level management, and they don't want to disrespect that person. So you have to be very respectful and yeah, kind of you cannot be so outgoing and ask these questions just straightforward directly. But it's easy to find it out if you ask the person and if they gain some trust in you, and that helps a lot. So what I started was to build a team of effective first level managers. And also, let me take a step to now. Now in 2025, I have two very important teams in the clinic. There's one team. This is the team is our top management. It's like me and the two main chief doctors in the clinic, and also like my closest coworker. She has kind of the same position as I have. So it's like 4 persons, and we are the top management of the clinic. But also very important is the first level management, so the management for every department in the clinic. And as you can see on the right side, we have the OCI results of the top management. On the top is like 4 persons, and I don't know if everyone in this meeting is familiar with the OCI tool, but let me give you a short idea of it. There are like 3 different sections of it. There's the red one. John, help me if I'm twisting up something. The red one is like for aggressive styles, and where it's about for example, you just try to get a promotion no matter what, and you don't care about other people at all, just going for your own goals. There's the green section. The green styles are the more defensive styles. To give you an example, as I mentioned, if you're in a meeting and you have 3 persons talking all the time and you decide not to speak up, then you switch into the defensive mode. Sometimes you just like, okay, this is right, even though you might have another idea. So you don't open up with all the ideas, with criticism and all the thoughts you have. So you have this aggressive style, which is pretty outgoing. You have this defensive style where you hold back things. And you have the blue styles, the constructive, where it's about cooperating, reaching goals, getting to know each other, build heavy relationships to your coworkers and everything. And as you can see, it's easy to see. You don't need to be so familiar with the OCI current. The top management has a lot of blue, effective and constructive has a very high results in that section. Of course, there are also like green and red parts. I think it's very important to be aware that there's not such thing as the perfect culture and not such thing as the perfect result. And I will also refer to that later on. Sometimes that's not even the goal, to have the perfect result in OCI terms, speaking in OCI terms. But as you can see, like the top management is very effective from the OCI survey, and also the first level management is dominated by the constructive, by the blue prints in 2025, so in this year. So this is like our current situation. So let me go back to the start. I was like, okay, where do I find these first level managers who help me provoke this culture? And so I started to sit down with the top management, and we brought a coach, and we asked him, can you help us to define a profile and ways of behaving that we want to look for when it comes to decide who is a good first level manager. And then we started to define some rules. And I'll give you an idea of what are these rules in our organization in Dr. Becker in our specific clinic. The first one is like every employer is part of a team that has a first level management. Sounds pretty basic, but you always find organizations where there are departments where just one person is working, and there's this one person sitting in the office, and there's no one around, and they come to work, they do their work, and they leave. Sometimes they meet some people at the break or something, but it's not like they come to work and they have the experience of being part in a team. And we made that as a clear rule for everyone in the organization. So even when we start to open up a new department, or for example, we need someone more specialized in anything, we always start thinking about, okay, in which team will we put that person, just to give that person the feeling of being part of a collective team. The second rule was that our first level managers still need to work in their team. So there's not such thing as a first level manager sitting in an office and having his team working somewhere. It's always like our first level managers are part of the team and working with them. Let me give you an example. For example, the nursing staff in some clinic, it's typical that there are a lot of nurses, and the first level management of the nursing team has an office and is working outside of the team. So it's not in contact with patients anymore. We don't want that, because we always want to make sure that our first level management is still experiencing the reality of their team. So that's why we decided to make this like the second important rule for first level managers. Even if there is a first level manager who doesn't want to work in the team anymore, sometimes people consider being promoted means not to have to work anymore in the team. This is like a no-go for us, so that won't work. The third rule is like our first level management leaders always have to be good listeners. So when we have a meeting, we don't want them like to take over the meeting and to dominate the discussion. We want a kind of leadership that is like, okay, just ask a question, leave room and space for the people to discuss the problems, to hear all the perspectives. And then when everything is said, it's like finding a way with the team together to find a decision and to make a decision together. So like our first level managers don't need to be people who are good in bringing solutions. They just need to be good in collecting them. This was like our third rules, and that's why we also want them to be able to encourage others to speak up. The fourth rule and the last one is our first level managers have good relations to the top management and to the employees, which is also a very important thing. If we look at different organizations, you will always find persons who have very good relations to the top managers, but are hated by their colleagues, by their coworkers. And sometimes you find it's the other way around. People that have very good relations to the team, but they don't get along with the top management. So, and for us, it's a very important thing, because if we want to have the culture in the whole organization, even our first level management has to be connected when it comes to professional stuff and also like personal things to either the top management and to the team. These are the 4 most important rules for us. And then I started to scan the organization for people who fulfill all these 4 rules. That was kind of the result of the coaching we did when we started. Of course, for some organization, these rules might not be practicable or not work out at all. But I just wanted to give you an idea how we started to start our way along. So what happened after 1 year when we started? We found we had like 8 teams. So we started organizing everyone in a team, and we had 8 teams after 1 year. And 8 teams had a manager, and we was like already progressing, because when I started, we had like only 4 teams, 4 departments that had first level managers. The other departments either don't had any managers at all, or they weren't organized as a team. So we started to build these teams, and we had 8 of them with managers. And this was kind of a achievement from by starting with 4. Then we did the OCI survey again. So this time I did not ask the 10 or 11 most influential people. I asked 70. I asked all of them. We were around about 100 people back in that time, and 70 of them replied. So we have 70% of crowd of replies. And in our results, we found out that out of these 8, out of all the teams we had 8 with managers and 4 without. We had like 4 very good results. Speaking in terms of OCI results, 2 of them were okay, like kind of some things were good, some things were bad. And we had 5 bad results, like, okay, this team is still not there, speaking in terms of our idea of how teams would cooperate and work together. We also had 2 teams that had no first level managers yet, so we were still looking for some. Let me give you an idea of it. I already gave you the checklist for first level managers, and sometimes there are just no persons in the organization or no persons in the team that fulfill all those 4 criteria we had. So then we decided not to choose someone else. So we prefer having no first level management than the wrong one, which was also like a decision we made. And those teams that did not have a first level manager back in those times, we arranged a team meeting with them, and we explained to them why they don't have a manager yet. And we asked them which out of the other first level managers from the other departments they want to have as their mentor. So some of our first level managers were like managing 2 teams, but the teams could choose who they want to be their first level manager then. So that's how we dealt during the time where we were still looking for the right persons. Okay, let's move on. There's also another checklist, things that are very important for us. And with this checklist, I'm trying to give you an idea how we, what is kind of a good environment in our perspective for a team. So there's always like 4 criteria. The first one is the performance, of course. We are still working. We are still running a business around. Our business is not about not about the healthcare system is always about the patients and helping people to overcome their diseases, but also like performing in our manner is like helping our patients. And also there are other departments that are maybe dealing with administrative things, for example, making sure that the persons have fulfilled their forms before they start arriving. A lot of different stuff going on. So we also started like, okay, looking for the right KPIs in our organizations to measure the performance. The second one that's very important to have in healthy culture is, of course, to have a manager in the team. I'm convinced that every team needs a manager. There are also other concepts and ideas of teams without management, which might work also, but this is just not in line with our idea of running a team. So this is like the second criteria. The third one, this is a very important one. You hear a lot of people talk about toxic team members, about people interfering or disturbing the culture or relationships and everything. We also like made very clear what kind of behaviors are considered toxic in our environment. Let me give you some practical examples. For example, as I mentioned before, when you join a meeting and you have one person talking all the time, cutting other people off, not listening closely to other opinions, this is kind of a toxic behavior, which doesn't mean that we always fire everyone who is like cutting anyone off once. But we started like being very consequent with this. So after the meeting, we would call that person out, have a talk outside of the meeting, and tell them, okay, we're seeing this kind of behavior, and you are like disturbing us to develop into a better culture when it comes to meetings. And yeah, we started to reflecting that with them and help them to change their behavior. Also, the fourth, a very important thing is like welcoming the cultural change. You can have a very performative team with a manager, with no toxic members, and maybe the team has the opinion that it's normal that only two people are talking. And maybe the team has the opinion that it's normal to be rude to each other. Maybe they have the opinion that they don't need any good relations to the top management. I don't know. There are a lot of ideas and concepts out there, but that's also a very important thing. So it might sound easy, but sometimes it's just important to ask someone if they really want to change things and really want to develop into this picture that you gave them, or if they feel like no, they're more like kind of more familiar and they want to stay in the culture that they have right now. Maybe some people don't even want to speak up. Maybe some people don't even want to share their ideas. They don't want to criticize anyone. So this is a very important thing too, to find team members that are really welcoming the change. After 2 years, we were like organized in 11 teams. All the 11 teams had managers. So it took, I think this is also very important, it took 2 years to find a first level management that fulfills our criteria for every team and have every person in an organization organized in a team. So it took us 2 years, and we started with 4. We had 8 after 1 year, and after 2 years we have 11 teams. All of them had like managers, and also like we arrived at 6 OCI results, with good results in their team, with a good culture, and one of them was like okay, and we still had 4 teams with bad results, with results that are not in line with the culture that we are still trying to reach for the whole organization. But this is a milestone too, because we have no teams anymore that have no first level managers, that are not working in their department, that are not familiar with the work environment, and that are not fulfilling all of the criteria we have. So now we can make sure that if there's a team meeting, no matter in where department, for example, they stick to our code of behavior during a meeting. Okay, so let me close this with 2 very important learnings I also want to give you. There are also like teams that have different perspectives. I think that's also very important because it's not about having a good OCI result. This is not the main goal for us. The OCI is just a very powerful and helpful tool to become an idea of what's going on in the department. And when you have these results, you can decide how to work with them. And that's why we always decided to discuss the results in every year with the departments. And after 1 year, let me take this example of our nursing staff. I talked to them why their culture is so defensive. You can see that on the right side. The green spots are like highlighted the most. So we started to talking to them, and we were like, okay, because I was wondering, they are very qualified, they are very performative, have very good relations towards each other. This is the team with the lowest number of dropouts in the past 5 years. So there are a lot of things going pretty well in that team, but they are still very defensive. And I was like, why is that? So I started to ask them, and they told me that for them, for their stuff, they have kind of a professional ethic and an identity as a nurse, which is in a way like it's not their job to come across with solutions and to be innovative and to criticize and to bring up ideas all the time. It's more like their job to execute and to help the doctors to make sure everything is going that way that they decided. So it's like they are in a way giving the responsibility for medical decisions to the doctors. And that's what they were like, okay, this is very important for us as nurses, because there are a lot of things where we have an opinion, of course, and sometimes we decide to share that opinion. But in the end of the day, there are a lot of things going on in our department that we are not where they are not even able to have a qualified opinion on. That's just their perspective. So we just have to respect them for their perspective on things. And I was like, okay, this makes sense to me. And this is a good example for a department where everything is going fine. The results are there. The people in the team are happy. No dropouts. Everything is going well there. And even the patients have they do a survey during our treatment. They're in our clinic for 5 weeks, and they rate all the different professions during their stay at our clinic. And always the nurses get like the best results from there. So even the patients consider them as being like the heart of the clinic. So there was no reason at all to interfere in that or to try to convince them to change anything. So this is also like a possible outcome of and a way to work with OCI results. So speaking in terms of OCI, this might be a bad result, but if you see the clinic as such and how it's organized, and if you talk to the people, it's absolutely understandable where it comes from. And then it's not a bad result, then it's a result that's in line with the culture that we want for the nurses want for themselves, and that helps us to reach our goals. So this is also like a very different perspective I wanted to give you, where this tool can be very helpful too, just to have an idea of, okay, there are some people in the organization that have a very different perspective on things. I think I would never had that talk with them if I didn't have the results of the OCI back in the days. And I also want to give you another idea of a very interesting example. This is another team. The reception is like a very centered department in the clinic. It's like when patients enter the clinic for the first time, it's like their first contact. And also like during the time, every time a question appears, they went to the reception and they get help from there. And when I started in the organization, this was a very effective team. They were like working very quick, very efficient, and they were very professional, kind, respectful towards the patients. But behind the curtain, you can always find them fighting for things, different opinions. It was a very harsh and a hard culture in terms of interacting with each other. And this is one of an example where I found out, okay, this only comes from just one member of that team. And when we found out, okay, we have just one person who is kind of making this environment so full of conflict, and we decided to let that person go. And we also decided to promote one person out of the team to the first level management, because that person was fulfilling the whole checklist. It was like everything arranged by itself. So it's just like, okay, just let one person go, promote the right person, and it's done. And the team developed into, after 6 months, you can tell everything is running very well. And you can see on the top the result after 1 year, and the bottom one is after 2 years. I think this might be one of the best OCI results we have. Maybe just the top level management is better than that one, but it's a very good one. Yeah, and you can tell that sometimes it's not about managing a lot, or not about bringing ideas or discussing to them all the time. Sometimes you have all the knowledge, all the everything you need to provoke a good cultural environment, and also good results and a good performance in a team. You have everything already there, and you just need to change one or two persons to make things work. And I think that's also very interesting that sometimes it's so easy, but it's it's about to find the right kind of rules for the organization that help you to spot the right persons or the wrong persons for the team. So I think we're almost at the end. I just wanted to show you some other things that might be interesting if you haven't worked with the OCI yet. There are also some sections of the report that are also very interesting for me. You can also like spot from every department, from every team, how much the team cares about, for example, if the customer feels good about the service. It's like the first graph over there. And you can see from the purple one, which is completely up, it's like it's telling that everyone out of the reception team is like giving 5 out of 5 as a result for how important it is for them to make our patients feel good and about their service. So they're very oriented toward the patients and service oriented. And I think that's very important for this department too. And also there are other departments where it's not about service, because speaking in medical terms, we all know that if we go to a doctor, it's not about that the doctor is serving and fulfilling all our expectations. It's about having a professional opinion of what is necessary and what needs to be done. But for this department, for example, this is very important. And you can see by the results that this department is very, very good in all aspects of the OCI. So this is where I'm done. Maybe we got some questions or other things we can discuss. We still have about, I think, 50 minutes to talk about some ideas and questions.
Yes, goodness. Thank you so much, Michael. That is a fantastic example. Very, very exciting. I've been taking notes as you were talking. I just have to point out, there's so many things that you did and your group has done, your team has done that are, just in line with what we talk about as best practices. It's not only the OCI is a very powerful tool for helping to measure and understand culture, but so many of the things that you said are the best practice methods for addressing and developing culture. The OCI is wonderful. It doesn't actually change culture itself. It takes much more than that. And what you did, and I'll point some of these steps out, are really fantastic best practices. Um, just for everyone, maybe this will help. If anyone has any questions, please feel free to type those into the chat, but happy to hear from everyone. The first thing I have to say is that you really, in the beginning, you took an approach where you were inclusive approach. So rather than just coming in with a survey and measuring culture, you were talking to your people about who is influential and what's happening here and who would you reach out to for help, to get a feel for what's really playing out in the business. That is something you'll also see in the data that OCI provides you with, but this is the difference between quantitative data that the OCI gives you and qualitative information that I always say sort of helps to fill in the blanks and provide color so that we can understand how is this happening, why is this happening, and what's the bigger context for culture development. And that's another important point that you brought across. It's really not about having any perfect culture. It's not about any right or wrong. Very much what I like is taking the perspective of that you did of what is best for our patients and what is best for our people. That is the core question that we really should start with. And I also like the fact that you connected this to business values. What are our values? What is that about? What is our purpose? And what kind of behavior from leaders and our people is in line with that bigger purpose. Another piece I think is very powerful is how you're able to give feedback. So you mentioned that we identified these rules. I very much like your rules, by the way. Another thing I think is a real strength. So while we give clients lots of data to diagnose culture, at the end of that learning, or as we learn from that information, we need to transfer that to the organization in a way that is actionable and really creates change. And usually what I find is that is some very clear, in a way, simple messages and guidelines, in your case, the rules that we need to stick to. I think the value of OCI and being able to measure culture is it gives us the framework to know where we need to focus and therefore what kind of rules or guidelines we need to reinforce in order to help move our people in that direction. Your example about feedback is a very good one. It is common that in teamwork, one individual might begin to sort of dominate the group and push their ideas through, and that has consequences, as we know. I like your statement about being able to, reach out to those people afterwards, give them some feedback in terms of how that comes across and the effect, so that people can learn and change their approach. And that's exactly the purpose of these kinds of tools. A lot of clients that I work with are hesitant to do this, right? They realize that people are doing things that are not consistent with the culture that we want, but they're hesitant to, reach out, communicate that. They're afraid it'll come across as criticism and that kind of thing. But I'm reminded of a quote. One of my favorite clients years ago had a quote about culture I think was very good. It was that your organization's culture is not only the behavior that you encourage in the business, but it's also the behavior that you tolerate in the business. So while we want to encourage typically constructive behavior that's consistent with values and performance, we also need to communicate and reinforce the fact that we don't want to begin engaging in other behaviors that have consequences or simply aren't consistent with the values and purpose of our business. So I think that's very good that you were able to do that you have those rules, you're able to follow up with them. That is a very strong best practice that I find missing in a lot of organizations. Another thing I really liked. Sorry,
Yeah,
go ahead.
I have also like an thought when it comes to feedback. I think when it comes to feedback, there's also like very important that giving feedback is not something which is just having one conversation and telling the other what you think. I always think like feedback is always like the start of a conversation. Like, okay, I
Yes.
saw you behaving like this and that. That's how I was sensing it. How do you think and feel about it? What was the reason for you? Why were you acting like that? Did you even realize that this happened?
Right.
So I think like the feedback is always is one of the easiest ways to start a good conversation, a quality conversation with someone, and get to the core of other things that are very important in terms of cultural things. So even when we give feedback about things that happened, we always try to be very careful with not jumping to conclusions. Sometimes you give a feedback and you already had made up your mind, but for me, it's like, okay, let's have a discussion and let's start a conversation about something. And the feedback is just a tool to start the conversation. I think that's very important too and helpful.
Very well put. I completely agree. Very well put. Good coach, I tell you. Um, Thank you. The other point I was going to reference was the fact that I really like how you looked for what we would probably call informal um, leadership structures in the organization. So when you started the presentation, you were talking about the fact that you're reaching out and trying to find who's influential in the organization. I think was the word that you used. And you never mentioned leadership, right? You're talking about who is influential, who would people reach out to if they need help. Those sorts of informal influence structures in organizations are very powerful. And while we know that, typically leadership and that sort of hierarchical um, structure is part of it, informal leadership is extremely powerful. And we have case studies, and you're doing the same, in which, we're trying to find those sort of influential members in order to hopefully bring them on board. And I think, as you said, help them to be, you called it part of your team. We always talk about the benefit of having an internal network of some kind in organizations to try to, communicate the message of where we're going and what the purpose is and what is good behavior that helps and what are the rules and all of those sorts of things. It's very difficult, even in an organization the size of yours, for one person to really drive that change consistently across locations and functions and all of those things. But if we can have a team of inspired members, especially those people who are influential, who others listen to, then we have a real way to leverage this message and spread that through sort of that internal network of champions, if you will. And that way we can get this message through the business much more consistently. We can sort of explain, what this is about across different functions so that people can understand, what this is about, how they can contribute. Um, and I always find that to be a very beneficial. And I like the way that you did it rather than the simple approach of, well, we need leaders on board, which of course is important. Finding those people who are influential and others listen to, those are very important to people to find to hopefully, like I said, bring on board and help make part of this mission moving forward.
Yeah, absolutely.
Very good.
Very
So,
good. I agree.
yeah. Did you find that people were willing to take part in this? Did you find that as you were reaching out and trying to build that team, that people were excited or hesitant to be part of the change?
Mm, maybe yes, maybe no. Sometimes, let me give you an example. Like these kind of first level managers that we were looking for, usually are not that type of people who are like focusing on getting a donation, a promotion. So they are like
Right.
more defensive, more calm, down to earth. So these are not usually the kind of people that are like, when you, okay, we're looking for a manager, they are not like, okay, I'm here, I'm ready. So it's like in most of the cases I had to approach them and be like, hey, I was observing things and I saw you doing this and that, and people are talking good about you, and I heard a lot of positive stuff about you, and I could see you in that role as the first level management. And sometimes it even needed some convincing work for me and encourage them. So sometimes it's not so easy. But it's also like, this is also like a proof for me that they're the right persons, because they're aware of the responsibility that comes with it, and they're also like, they don't see themselves as the person above everything. They still considering themselves as part of the team, which is kind of one of the criterias. So there's kind of this this aspect where they feel like, hey, I love to be part of the team, and I want to stay in that position in a way. But you can do so and still be a first level management, and that's when it comes to having good relations to the top management and to your team. So sometimes it's easy, sometimes not. But
and it's a way
in the end it worked out.
And it's a way to it's a way to drive that change through the entire business, rather than trying to kind of cascade it from the top down alone, which works, but it works much more cohesively when we can get people on board and inspired by this and willing to support that with their actions as an internal team. So very well done on that point as well. The last point I'll make in terms of best practices, although I've got a long list here, is the fact that you really took the effort to include everyone essentially in the project. So oftentimes when OCI is initially used to measure culture, perhaps organizations are using the instrument not across the whole business, but they're using it in key areas, oftentimes beginning with leadership teams to see what's playing out there, or in critical key functions like customer or facing, patient facing functions and that sort of thing. But there are a lot of benefits to including the broader organization. One of them I think you really pointed out nicely, and that is to see the differences that exist even in a fairly small organization. I think you mentioned around 100 members. Even in that size, we're seeing very different culture playing out in leadership versus nursing versus reception, and so on. And that's something we really do see in organizations. There are sort of subcultures playing out, and that's important for a variety of reasons to understand. I mean, for one thing, the more different these subcultures become, typically you find the more challenging it is for those departments to work cohesively together. So a lot of times we're talking to clients about not only typically working to develop more constructive behaviors in our culture, but to do that as consistently as possible in the organization. And I think your approach of including everyone, first of all, is a very positive approach that gets people on board. It gets them curious. It also gives you the big picture of what's actually happening in the business, not just what's happening in leadership or reception, but how this is all interconnected and playing out. And it also gives you the ability to see what's working. And I really like that about your case as well. You're finding parts of the organization where, maybe it's not as constructive as we might aspire to, but it's working. It's functioning. We're serving, our people are satisfied. And in that, again, there's no right or wrong culture. I always say the culture should be judged in two ways. One is whether it is enabling us to do good work and perform at our best. And the second way we can judge culture, I think, is based on our own values. Are we doing what we say we should be doing? Those are the ways that your organization can judge your culture. But none of that is good or bad or right or wrong. So I like the approach of looking at those profiles from the perspective of, what is working. And if we're having challenges, then there's our opportunity to take a developmental focus.
Yeah, absolutely.
Good.
Yeah,
good.
Thank
you.
And also, like the talk to the people involved always helps.
I'm sorry. Could you repeat that? I think I spoke over you. Excuse me.
I was just like, and also like discussing the results with the people always helps. Just have their perspective on their own culture and have their perspective on their own results. Always helpful.
Yes. Yes, yes, that is a huge one. I didn't mention, but you're absolutely right. Too often, when clients receive OCI reports and this data, they have the tendency to want to keep that secret and to share as little, perhaps, in a way as possible. But you're absolutely right. The more we can be open about this, the more we can share it broadly. This kind of development, I always say, is a learning journey. And so, by keeping this information secret, it prevents our people from learning and understanding these important topics, and it makes it harder for them to change and develop moving forward. So I always find, and if you have OCI reports and would like recommendations of best ways to share that within subgroups and departments, we can do that where we give you a report that's only includes that department's data so they can only see their own results. But the point is, I think it's very important. You're absolutely right that the people in the organization should be able to see those results, understand them, have them explained to them. That's part of the learning journey, and it really is part of the development. If we can't, tell people what's going on and where we want to go, then you can't expect any real development to sustainably be created. Very well done. How did your people take the feedback? How about that? How about that question? So when you shared the reports or the profiles with your people, how was that received?
Mm, I felt like they were pretty interested. Um, it's a very huge tool, if you ask me. So it's like you definitely need some time to, in order to understand everything. So I don't think it's helpful to discuss the whole result as such. So we just only go into the departments and try to point out specific things and try to find examples from their reality. So I think in most of the cases, their reaction was like they were very interested in
Hmm.
how um, like in the tool as such. How does the from out of these questions they find out so
Yeah.
precisely what's going on, and I talked a lot about that. But also like it was very interesting that some of our managers decided to discuss it with their teams on their own. So they were like, okay, Michael, I don't want you to talk with us together. They just want, okay, I'll take this and I will discuss that with my team. And also there were some others that were more skeptical, but was also like a good start for a conversation. Why
Good.
don't you think this result is right, or do you feel like this is not representative? Or also this also gave like very important hints, or sometimes they were feeling like something important was missing, and then they told me what was missing in their perspective. So having the dialogue and the discussion about the results is always helpful, and I think it's also important to leave room for to add something or to leave several results out. Yeah,
Hmm.
so yeah,
Fantastic.
I think it's also like always. It's mostly important to have the conversation and to point out things that you can take into action.
Yeah, yeah, indeed. Yeah, as much as maybe clients are oftentimes concerned about sharing the results, and I completely agree, right? The OCI reports are far too much information and data and technicality, but we do want to share the high level. We do want to help people to connect and understand the profile so that they can, have that. And typically, that's in my experience, that's not too complex. And the response from people is what you said. In most cases, it really is curiosity that they can learn about how this is all happening and what the culture patterns are and those big picture topics. And I also find it really helps to build empowerment in the business because once we can understand these things, then we start to see how each of us can contribute, how we could create change. Once we really understand what's happening, then we can start to brainstorm on, here's what we could do differently, here's how we could grow even further. Again, not about right or wrong, but moving forward, what would be even better than what we're doing now, I guess is the way to take it. Um, Fantastic points. And the other thing I really, really liked, and this is another thing I hear from clients very often, is that, the pace of change today is so fast. Organizations are having to be more adaptive than really ever before. And I really liked your statement in there about how your organization is successful and effective, but we're trying to build an organization for the 21st century. So that future orientation and perspective of, again, it's not about anything that we're doing now is wrong or broken, but if we want to build excellence in the future, and right, what does that look like? And that kind of future oriented developmental perspective, I always find is very, very helpful for this kind of development. So with that, what's next for your organization? What do you see as being next steps or the future for this culture development?
This is kind of a very interesting question because I don't have an answer yet. After the last
Fair enough.
results,
Yeah.
usually after the past results, we are always like, okay, we need to focus on this, we need to focus on that, we need to focus on this. But after the last results, we were like, okay, let's not start to take actions again out of the results. Let's just wait for another year and give the team give some time to the team to get to know each other better, because we're now like in it's like this year there are almost no people leaving the company, so absolutely no dropouts, almost close to zeros. And
Congratulations.
so this is like, okay, let's just see how things develop during this year and have another result then, to
Yeah.
see if things are going naturally, developing naturally, or if we still need to take any actions. So this is like a more observing and a more laid back part of the journey of yeah, our clinic.
Very good.
Very good.
Yeah, I
Yeah,
know
I
that's an
know that's an
important part of
important
the
part of
journey
the
as
journey as
well,
well.
because we need time to allow this change to happen and for people to sort of form a new habit and a new pattern in terms of how they work. And in many cases, I don't think it's helpful for change to be constant. I mean, I know change and development is pretty constant in the marketplace, but we need to be, I think, conscious of that in organizations, that we don't create a situation in which employees feel that the organization is in a state of constant change and constant flux. Um, Happy to, that's a whole side topic, but anyway, for development, I think it's helpful. We get good information, we make key changes, rules, guidelines based on what we've learned, and then we allow for that to have an effect, sink in, and check on that as it goes, and then we can address, as you mentioned, we can step in later if changes and tweaks are needed. But I think it's really important to allow that time for your people to come together, as you said, the new managers to really fulfill that role. And you'll see that, as you have, changing and influencing the culture of the business as you move forward. So it's not about constant change, which is a lot of, I think, what clients are concerned about with culture development. It's about specific development, specific change, targeted change, rather than constant change. So I think it's very good that you give your people that time to sort of settle into a new way of working, and see how that works. Indeed. Fantastic. Well, it certainly does seem to be on the right track. Congratulations on the employee turnover. It sounds like engagement and commitment to the organization is on the rise as the culture develops as well, and that's something we very often see, and that's a wonderful sign. So, thank you so much. That is all my feedback for now. I've gone over time, as I could imagine, with this fantastic case. But Michael, I can't thank you enough for sharing this example. I think we've all learned a lot from it. Congratulations to your organization and the rest of your team, and wish you all the very best as you continue that learning journey.
Thank you. Thank you for having me. And yeah, same to
Fantastic.
you.
Thank you,
Thank you.
sir.
Thank you, sir.
I look forward to it.
Look forward
All
to it.
right. Thank you
All
to
right.
everyone
Thank you to
joined.
everyone
Again,
joined.
we'll
Again, we'll
post this recording on our website. So if you want to come back to these good lessons and best practices, you'll have that resource. Thank you again, Michael, and great case of developing culture. So thank you so much.